everybody, Dr. Danita, Orlando Mobile Vet here. Excited to bring you along on our journey today. We have a couple of different patients we're going to see today. One is getting a dental cleaning, and then we have a 5-pet visit. Lots of cute dachshunds, the wiener dogs if you don't know the name. So we look forward to seeing you, and we're excited for you to come on this journey with us. So come along. We are prepping for a dental cleaning. Robert is getting his first dental cleaning today. His teeth are not too bad. He has a grade 1, like not even grade 1 periodontal disease. He doesn't have too much issues with his teeth. But mom is a very proactive dog mom, so she wants to make sure his teeth are always pearly white. So we're gonna do his first dental today. He's a 3-year-old male intact Coton d'Etelure. That is his breed. He is well maintained and manicured. His hair is always beautiful and flowing, so you get to see him soon. He's a beautiful boy. So this particular panel is a prep profile, so we're checking his liver values as well as his kidney values and his glucose, just to make sure that all of his functions and his metabolic functions inside are working correctly, just to make sure he's safe enough for anesthesia for the dental cleaning. So we have a grading system for periodontal disease. So it's graded 1 through 4. So grade 1 is mild, a little bit of gingivitis. They're starting to have more issues with their teeth. Grade 2, they have more tartar, a little bit. It's covering more of the actual teeth. And then we pretty much, it's a subjective grading system. As you can probably assume, grade 4 is the worst. A lot of times when they're grade 4, the teeth are completely covered with tartar, really severe gingivitis, or sometimes the gums are bright red. And they may be at the point where they're already losing teeth, or they're in the process of losing teeth. So once you start cleaning those teeth, a lot of times, a lot of teeth will start falling out as soon as you're cleaning the mouth. So those are more severe cases. The good news is your dog or cat will feel much better once they have those teeth cleaned and those teeth removed, because they'll be able to eat better, they'll be able to feel better. So we typically recommend getting their first dental cleaning when they're between 1.5 to 2 years old. So he's right at that line where we would start doing dental cleanings yearly. We don't always have to do it every single year, but it is, recommended to do it at least once a year. And then in between, you're doing dental treats. Ideally, brushing is always best. Sometimes that can be really hard, but sometimes we'll recommend like the little finger brusher where you just kind of go in the mouth and you brush the teeth with that, or using a dog or cat toothbrush with toothpaste specifically. All right, chemistry is done. It looks great. So these are his values. So his liver, kidney values all look wonderful. Glucose is a little on the higher side, but he didn't have breakfast and he's a little stressed, but that's still within range, so we're okay to start. So I'm gonna go ahead and pre-med him. He doesn't have much tartar on his teeth, but his teeth, they're pretty sticky with the tartar that he has. So I'm glad we're cleaning his teeth really good, because sometimes brushing isn't going to be enough when his mouth has this really sticky plaque. After we clean them really good, then we're going to polish them, because when you're cleaning, you're putting little teeny micro cuts on the teeth. So you want to make sure you polish to fill in the enamel. Kind of like when you get your teeth cleaned, same thing. The longest part for him was getting him set up and prepped, because we had to get his blood work, we had to make sure he was healthy. But for him, the cleaning portion is probably the fastest, because his teeth luckily aren't that bad. So this is the quicker part of everything for him. Alrighty. And we're gonna wake him up and recover him once he starts waking up. We will extubate him, which is removing of the tube once he's fully awake. and then we'll recover him, make sure his temperature looks good and everything. We'll probably wait like another 30-45 minutes until he's fully awake and able to walk inside. So we're all done with Robear's dental cleaning. We are headed to our next appointment after a quick lunch, but he did well. Mom was super happy. She was a little nervous, but now she knows about dental care and how to maintain his teeth. So we'll see you at the next one. They did x-rays of his chest. He did have cardiomegaly, which is enlargement of the heart at that time. But he's doing okay. He's currently on heart medication. So we're just checking his heart, making sure everything looks good to continue his heart medication. So he is Doxy number 1 that we're seeing today. And he's a runner, so we can't let him go. Mom said if you let him go, he will run down the street and then he might be at the lake and we'll never get him. But right now all we know is his heart is enlarged and he has some form of heart disease. But the echocardiogram will give us the full picture of what's going on with the valves and what we need to make sure we need to keep up with and how damaged they may be. Up next, we have Cooper. So everyone's getting an exam, a comprehensive exam, and they're all getting heartworm tests, except for Ollie. Ollie was just an exam just to make sure he was good to go for his heart meds. But everyone else is getting comprehensive physical exams, head to toe checkup, heartworm tests to continue their heartworm and flea prevention, and Holly is getting just her rabies booster. That's it for today. We finished with Robear this morning with his dental cleaning. He did great. Make sure you keep up with your pet's dental health. And our cute 6-pet Doxy visit, 5-pet Doxy visit today. They all got their heartworm tests and checkups. They all are looking great. Make sure you keep up with your heartworm and flea prevention for your dogs and cats, because here in Florida, it is a big problem, and in a lot of states it is as well, and it is a deadly disease. So make sure you do not forget that. And if you love these videos, definitely check out the next one, follow along, subscribe, and we look forward to seeing you in the next video.